Hey everybody, a little bit more on how to know it's not a subungual exostosis. This is where we're going to dive right into whether there could be differential diagnoses that are more likely to be the case than, the subungual exostosis that we see in this image here of a lateral isolated X-ray. Now, it's very common to be an ingrown toenail, and that's definitely what we're seeing more often when we're in our clinics. And so, if you see an ingrown toenail, I'll always say just double check that it's not a subungual exostosis causing this pain or causing the ingrowns to be occurring. And, whereas on an ingrown toenail, you're pressing the sulci or the sides of the nail, typically I'm finding that a subungual exostosis is going to be more apparent when we're pushing distally and we're finding that hard osseous mass that's deep underneath the skin, but really quite superficial to feel, and then that's going to be what we're looking at. If you're thinking it's ingrown toenails, treat those. If it's still not been recovering, then that's where we're looking towards the subungual exostosis potentially. Another thing that it could be is an osteochondroma or a benign cartilaginous mass that's coming out of the big toe. Typically we see this as like a calloused area, and then it could be coming through like a tower on the hallux. And it's something that's very, very obvious on x-rays. And so as soon as you see an abnormal callus or hyperkeratosis around the hallux, that's where I'd be looking at an x-ray, and they're very clear, so you should be able to see that immediately. There could also be a foreign object, and so although it might be painful at the tip of that hallux, double check on what you're looking at. If the x-rays come back clear, you can definitely seek a second opinion, and I'm more than happy to answer those over email if you're unsure that the patient is requiring to come through. But definitely having a bit of a further look and seeing, okay, could there be a foreign object? Have a bit of a chat about their history and what they've been doing in the last few weeks, because that will typically give you a bit of an indication of what you're looking at there. Don't forget that there could be gout of the interphalangeal joint that's just causing broad inflammation. Typically this is going to be a palpation sort of differential here, and so if it's more of the joint rather than the end of the toe, again this is sort of what you're looking at being the concern. Red, hot, swollen, bit more proximal, it's definitely more likely to be gout than a subungual exostosis. But for patients who have undergone those ingrown toenail procedures, maybe they've had 1, 2 or 3, there might be a little bit of redness over the top, you're not sure what's happening. It could be an iatrogenic osteomyelitis infection. That's where it's a post-procedural infection. It may not be coming up as that ingrown toenail, but deeper down there could be something going on. If it's a bit longer term, doing your x-ray initially will give you a good idea, but otherwise contrast CT or MRI could be the best way to differentiate where there's some osteomyelitis happening at a deeper level. But for now, hopefully that's given you a bit of further information on how to know it's not a subungual exostosis and some of the differentials and how to tell between them. But if you're liking what you see, hit our subscribe button, check out some of our other videos on subungual exostosis as well as other conditions, and we'll see you in that session. Cheers.